Tell us, how many fewer clinical trials would you fund in the next fiscal year with a budget cut of $18 billion?
Senator, can I just address the HIV? Because I am absolutely committed to in 2019.
How many clinical trials across the country have been impacted by the grants you have terminated, frozen, or delayed?
Senator, I don't have the numbers for.
No one is asking you to make it harder to research Alzheimer's disease, and no one is asking you to cut life-saving clinical trials.
I mean, that's.
You're asking for a budget. We're trying to figure out what that will fund. That's our job.
The number depends on what.
The National Institutes of Health, NIH, is the heart of America's biomedical research, responsible for developing treatments and cures for diseases like cancer, Alzheimer's, and HIV. For years, bipartisan support in Congress has ensured strong funding for this work, keeping the U.S. at the forefront of global medical innovation. However, the Trump administration has proposed a drastic 40% budget cut to the NIH, alongside the termination of thousands of jobs and the halting of billions of dollars in critical research grants.
Thank you. We have been joined by the Vice Chair of the full committee, Senator Murray, and welcome her here.
Thank you very much, Madam Chairman. Welcome to our committee. You know, I am extremely proud of the work that I've done on a bipartisan basis to strengthen our investments in NIH, to support life-saving research, and to really maintain American leadership in biomedical innovation. I'm not going to mince words today about how that progress is now being unraveled. What the Trump administration is doing to NIH right now is, frankly, catastrophic. Over the past few months, this administration has fired and pushed out nearly 5,000 critical employees across NIH, prevented nearly $3 billion in grant funding from being awarded, and terminated nearly 2,500 grants totaling almost $5 billion for life-saving research that is ongoing, that includes clinical trials for HIV and Alzheimer's disease. Across the country, including in my home state of Washington, research institutions have been waiting for months to receive funding for grants they've already been awarded. Meanwhile, NIH is cutting down on grant awards, with thousands of fewer research grants this year and almost 15,000 fewer next year if the administration has its way. Because to pile on this destruction, you and the president are requesting that we now slash NIH budget by 40% or $18 billion. I cannot fathom to what end. The Trump administration is already systematically dismantling the American biomedical research enterprise that is the envy of the world, throwing away billions in economic activity in every one of our states and jeopardizing the life-saving work of researchers across the country. This budget proposal would effectively forfeit our leadership in research innovation and competitiveness to China. It would mean we depend on China for the latest treatments for devastating diseases. No one in America wants us to do less cancer research. No one is asking you to make it harder to research Alzheimer's disease. And no one is asking you to cut life-saving clinical trials. We are hearing this from the experts themselves. You just received a letter signed by hundreds of your own staff who believe this administration's actions risk breaking NIH and the life-saving work it does. I really hope you heed their warning, and it should go without saying, but I expect none of them to face retaliation for raising those concerns. Everyone on this dais wants NIH to succeed, and you're going to need to see some major changes from what you are doing right now to get us back on the right path. Now, Dr. Bhattacharya, we spoke on the phone last week. I appreciate that. I want to follow up on those questions and what I've been trying to get answers from you for months. You told me 25 staff have been fired from the NIH Clinical Center out of the 1,445 who've been fired across the entire agency. But that does not include staff leaving after being offered buyouts or threatened with future layoffs. I want to know what is the total number of employees who left the clinical center and the entire agency as a result of the Trump administration's personnel actions in total.
So for the numbers I have in front of me are for the reduction in force. That's the 25 I mentioned in our conversation. We'll get those numbers for the retirements to you.
Well, I told you I was going to ask for this administration over the phone. I've requested this multiple times. How come you do not have that for us today?
Yeah, I thought it's my misunderstanding. I thought you were asking for the reduction in force numbers, which we provided.
No, I was being very clear. So I want to know, by the end of the day, can I have a detailed list of the reductions in staff by institute, by center, by job function? Not just the RIFs.
Not just the RIFs. We'll get you those.
Total staff reductions. Can I have that by the end of the day?
Yes.
Okay. Those are really basic questions, and I want to see that by the end of today. Now, I am also particularly concerned, as I told you, about cuts to clinical trials, which are harming patients' care nationwide and the chance for better treatments and cures. NIH has now terminated at least 160 clinical trials. In addition to terminating grants, you are also delaying grant awards and freezing or significantly delaying institutions from being able to draw down their grant funding, which is disrupting clinical trials, to say nothing of the research that it is now threatening. How many clinical trials across the country have been impacted by the grants you have terminated, frozen, or delayed?
Senator, I don't have the numbers for the specific number of trials. We've worked to make sure that the patients enrolled in the clinical trials have any delay in their care as a result of in 2020, the NIH terminated a very large number of clinical trials.
Well, I'm asking you about today, under your
I don't have the
direction.
specific numbers, and a lot of that is subject to negotiation. I've set up a process where people can appeal for if there's any decisions made regarding grant pauses and terminations, and we're actively working to make sure that we can make that appeals process is going. The numbers are in flux, and we'll have to get some of those numbers to you later.
We do know that patient care is being impacted at your own clinical center and in more than 100 clinical trials in the country. On May 30th, you terminated a 23-year research effort to develop an HIV vaccine just as scientists, including at the Fred Hutch Center in Seattle, are on the cusp of a functional cure for HIV. Terminating those HIV vaccine trials now cuts off access to treatment for 6,000 patients in the network.
These cuts threaten ongoing clinical trials, life-saving research, and America's leadership in medical science. This Senate hearing, led by Senator Patty Murray, addresses the urgent need for answers, how these cuts are affecting patients, research institutions, and the nation's future in health innovation. At stake are lives, jobs, and America's leadership in global health.
You canceled a clinical trial evaluating new evidence-based interventions for type 2 diabetes in rural communities in Appalachia. You terminated a clinical trial studying immunotherapy in combination with monoclonal antibodies to treat women with recurrent ovarian cancer. That is what has already happened. So now you are coming to us today proposing to cut NIH funding by 40% next year. Tell us, how many fewer clinical trials would you fund in the next fiscal year with a budget cut of $18 billion?
Senator, can I just address the HIV? Because I am absolutely committed to in 2019, the President Trump issued a challenge for us to eliminate the threat of HIV in this country, and we've had a 22% reduction in HIV transmission since then. We now have the technological tools to do that, and I've been working on developing a program to actually implement this vision so we can use new advances.
But you did terminate the HIV research at Fred Hutch that, again, was on the cusp of a treatment for 6,000 patients nationwide. You did do that.
I'd have to get back back to you
You
on that.
did
I
do
should
that.
check
Okay.
Senator, I mean, I think we actually have now the chance with the existing technologies, lenacapavir and other technologies, to actually address.
I'm delighted to hear that, but
Yeah.
I'm just telling you what clinical trials have been terminated, and I'm asking you this because we have to write an appropriations bill. How many fewer clinical trials will you fund in the next fiscal year with an $18 billion cut?
Well, Senator,
That's your budget request.
The budget request is a work of negotiation between Congress and the administration. President Trump has issued a letter to Secretary Kratsios committing the United States to be the leading nation.
Yeah, okay,
in
well, you're not
biomedicine.
answering the question. We need to know how many fewer clinical trials. Can you get that number back to me, please?
I mean, that's.
You're asking for a budget. We're trying to figure out what that will fund. That's our job.
The number depends on what the requests we get for proposals from all across the country. The budget itself will be dependent on what you all do as well as what the
Well,
administration
I know,
does.
but we are trying to write a budget with the knowledge that you have, with the requests that you have. I'm asking a question, how many fewer clinical trials? We need an answer back to that.
Well, Senator, it's hard to give an answer to that because I don't know what the proposals are going to be that are going to come in, right? I mean, you're asking
Well,
a hypothetical question about what the
You
scientific.
came here today to ask for a budget that reduces NIH significantly. I would expect as director, you would know what the impacts had. We need to know what the impacts are in order to fund that budget.
Senator, I mean, it's hard to say exactly what the researchers of the country are going to do in response. I mean, for a hypothetical budget.
Would you say there's going to be more clinical trials under that?
Under
an $18 billion,
it seems unlikely.
40% cut?
It seems unlikely. But I'll say this, that the budget itself is a negotiation between the administration and Congress. Congress allocates the funds. I am absolutely committed to make sure whatever the allocation goes, that we address the health of
I
the
know my
country.
time is way over, Madam Chairman, but I think the point is really important, that you are asking us for a significant reduction. It will impact the health of the United States of America. This committee has an obligation to know how you are spending that money. Thank you very much.